Good evening, good afternoon, and good morning. This is the 96th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. S. Bhuvaneswari. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. The international session begins from 8:30 to 9:30 and the local language session from 9:30 to 10:30. That is in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same as well as share it with your friends without paying any money. And as you all know that we are about to celebrate the our 5th year of anniversary on September 28th at Cochin Taj Hotel, the 5-star hotel here in Kerala. And we have planned a lot of homeopathic discussions, seminars, as well as um, appreciation to our faculties, as well as some other local programs in the evening too. I hope all of you are aware about this, and we will be forwarding you the first report of the same in a short time. We will be sharing the same within a short while from now, and we have a lot of things arranged for you. Hope all of you will be joining us there in Kochi so that we can have a one-to-one meeting there. And this is the second time we are doing. Last time there was such a big meeting when we celebrated the 1000 day, but it is the 5th year. That is the most important point, and we will be arranging a big session for all of you there. And let me come to today's guest. And as you all know, today our guest is Dr. S. Bhuvaneswari. She has completed BHMS and is chief physician at Adisha Holistic Homeopathy Clinic, Raghavanagar, Chennai, and that is in Tamil Nadu. She is the IHMA women's chairperson also, and she has graduated from the prestigious government homeopathic medical college, Madurai, and her journey began at 2007, and now she has given commitment and excellence to attend with the exceptional diagnostic skills. Dr. Bhuvaneswari established the Adisha Clinic in 2015, located in Chengalpet, Tamil Nadu, and she's doing excellent work there. And she has lot of homeopathic consultation every day, and she has written a lot of articles, particularly in Hafte and Dare, showcasing the depth of her clinical experience with the success stories. Furthermore, her insightful online articles have transformed linguistic barriers, reaches global audience through translations and multiple languages also. Translations in multiple language also. And today, Dr. will be discussing about scope of homeopathy in myositis ossificans through a constitutional approach with some of her successful case presentation also. We welcome you. Yes, doctor, you can be in the session.
Yeah, good evening, sir. Thank you again for the wonderful opportunity in this great platform. This is my third session today in the same platform. I am very happy to share my knowledge and so that we can be able to grow together and learn together. Thank you, sir, once again for you. I'll start my session.
Yes.
Can you able to see, sir?
Yes, yes, yes. Everything fine. You can go ahead.
Okay. Thank you, sir. Today's my topic is scope of homeopathy in myositis ossificans through constitutional approach with solved case. I have here mentioned only one solved case. The reason is that I want to explore the scope regarding the challenging case, the hopeless case into hopeful case through constitutional approach, personality justification along with miasmatic role and temperament role. That is the main reason for me. So that here, as a gist, I will tell the selection of the remedy also, because the reason is that I didn't stop the selection of the remedy completely with only few points. I have explained and differentiated through doctrine of signature as well as the human revolution. The main theme, whenever I select constitutional remedy for any person, I generally relate that particular drug, whatever could be the source of the remedy, along with the habitat as well as the doctrine of signature. That makes me to choose exact simillimum. Here I will start my case. Here I covered the points of introduction about the myositis ossificans related with conventional treatment and understanding the homeopathic perspective and miasmatic approach to justify the personality to identify the stage of the miasm, case evaluation by framing the totality with characteristic features, physical generals, mind symptoms, as well as the treatment, past history and family history. Along with that, evaluation of the drug before finding out the simillimum with framing the totality and monitoring the follow-up with before and after treatment with the photographs, and the final justification with doctrine of signature. This is the theme I have chosen here. This is the case I have mentioned with the photo. This is the actual stage of the particular person came to me. She is just 27 years age old. She is a foreigner. She started treatment from me through online. She is a German lady. Around 2018 it happened. This case, myositis ossificans, the reason is that it started with just pain, actual pain. Whoever, because this leg pain or calf muscle pain or tibia pain is very common to every human being, especially with the woman personality. The reason is that the deficiency of the vitamin D, calcium plays the major role in developing the such pain. She ignored that this pain might be related with too much of household works. As she was a working person, she is a salesperson. She created her own interior decorative works like wall hangings, flower vase, and all showcase materials only with the art out of waste. This is her caliber, as well as this is the bread and butter for her to support her family financially. The myositis ossificans is nothing but the abnormal formation of bone within the muscle tissue leads to the blood impairment circulation in the particular part, leads with the underlying structures start getting necrosis as well as gangrene due to the absence of nutrition supply as well as absence of the blood supply to the particular affected part. There are two types of myositis ossificans which is connected with muscle injury. It can be sometimes connected with, if it is non-hereditary, it is connected with muscle injury, the long-standing pain, where we are ignoring that particular thing as it is general pain because of heat or because of injury. This leads to later stages with the degenerative changes in the muscles as well as bones. Second type is myositis ossificans progressivans. This is related with inherited degenerative disorder, mostly connected with autoimmune disorder. This is the quite example to the particular lady where she doesn't have the history of any injury or hurt. This is completely related to her only with the immunity as well as the inherited genetics through her parents. This is a beautiful story, though it is connected only as a being a homeopath. We can see this particular thing in two aspects. This is also a case like regular case. In second angle, we can see the same case as a miraculous cure, where I saw like this only, because while I am preparing this PPT in the morning, I felt heartwarmingly that how I have changed the life of the particular lady, where the allopaths asked her to amputate because that is the only choice for her to save her life. They gave only two choices. You want to save your life or you want to save your leg. By considering these things, by considering this situation, I made her life to be sustained till today. She is very healthier without any additional medical support. So this is the beauty of homeopathy when it is handled through Hahnemannian principle as well as through constitutional personality justification, choosing a right simillimum with applying all the cardinal principles in homeopathy. Of course, the miasmatic approach on myositis ossifigans comes under triamiasmatic like every disease. So, there will be initial stage of all the inflammatory signs of pain, redness, burning. Sometimes there will be excess stinging sensation. This is the inflammatory stage of SORA. Psychosis, where the degenerative stages started, because always psychosis comes under irrespective of any stage of disease or any disease inside the body. It indicates the proliferation and accumulation, the abnormal structural patterns of the cells or patterns of the particular part of the body connected with muscle, bone or tissue. So this is the psychotic stage where the degeneration started because of the abnormal proliferation leads to the obstruction of the blood supply to the particular part, particular bony tissue connected with muscles, ligaments and tissues, where the patient experienced the limiting of the movement and immobilization of the body started developing in the, especially in the particular affected part. Syphilitic stage, where the excess of degeneration inside the body leads to the abnormal offensive discharge which excoriates the surrounding tissues both inside as well as outside the body, even the skin. Here, the mobility of the particular part will be completely zero because of the lack of sensation, where the nerve innervation also gets damaged in the syphilitic part. Here, the lady is more predominantly in the stage of syphilitic miasm and partial psychotic miasm rather than psoric phase, as the allopathic doctors suggested her to do the amputation of the leg. This is the case evaluation from my clinical desk. A 27-year-old woman started complaining with the pain and difficulty in walking with the mobility impairment, where when she consulted me with the foul smelling discharge from the wound, which gets more aggravated after the dressing and after the bathing, where she has to take care of cleansing the wound as well as cleaning the particular part, because she has to be very careful in taking care of the particular part without getting disturbed by infection, because opportunistic infections are very common. The reason is that not because of wound. Here the reason is autoimmune disorder, where the immunity of the particular lady will be very low. But I advised her to do dressing 3 times a day without closing the wound. This is the particular thing I advised her. The reason is that covering the wound keeps the lack of air and lack of fresh air supplied to the particular wound, which there is need of oxidative process, which is essential for our body, not only for respiration. Each and every cell in our body needs proper amount of oxygen. So I advised her to take care of her wound only with open wound by dressing 3 to 4 times a day, not covering the particular wound. I advised her only to just close the wound by a normal cloth only in the night time to avoid further damage to the particular tissue while she was sleeping. Otherwise, her sleep will be completely disturbed because of taking care of the wound. This is the advice I asked her to do along with my support of homeopathy. Her physical generals to understand the personality who she is. She reported the disturbed sleep due to the not only with the pain or not only with the suffering what she is facing through this particular problem. She already having a long-standing insomnia because of her mental stress, because of overthinking about the financial insecurity, future insecurity, and the overwhelming feeling of the moral support without getting support from her own husband, as well as ailments related with the bullying and harassment of the mother-in-law, as well as childhood history of emotional trauma because of her father, where that particular father was alcohol, always bully her with his words, doesn't show the love upon her, upon his own daughter. This is the emotional trauma where she faced a lot. She has one sibling, younger sister. She was the elder to the family. She got married very earlier, around 23 years, with 3 kids. This is her emotional background related with the family. She is thermally hot. She was more disturbed not only with a disease or not only related with health. Her concern is that how I will take care of my family, both morally as well as financially, by keeping this leg when there is the situation of getting amputated. That's why, with her friend's recommendation, she approached me where she doesn't have any awareness regarding homeopathy. She simply approached me and asked me the first question before starting my treatment is that, can you able to save my leg without amputation? Can you able to save my family by supporting me to take care of my health, to recover back my health? This is the only statement she asked me. Not even she asked me what about the regarding the charges, regarding how many months you needed to cure me, like that. So her basic concern is that not with self priority. Her basic concern, her always thought process surrounds only with her family, only with taking care of the bread and butter of her own kids. This is the emotional background of the particular lady. Her thirst is very moderate. Sometimes even she forgets to drink when she is in the urge of developing the creative works, use of art out of waste to support her family with bread and butter. She has the particular craving for milk and fresh juices, as she was financially unstable. She doesn't care about what food is available. She is very comfortable only with the liquid foods like juice and milk. That could be also the added reason for her to develop as a consistent craving for milk and juices rather than demanding the food, especially related with non-veg or veg. Her appetite is always decreased due to overthinking, due to mental stress, desire for salty foods and sweets. So her basic need of craving rules around this might be connected again with emotionally, or again it might be connected with a syphilitic background, or It might be connected with the financial thing, because for food means she has to invest more rather than choosing snack items or juices or milk will be financially less. That could be the added reason for her cravings also, because she is in the family background of not financially supported even in her young age. That's why she doesn't study properly. She studied till only 12th standard. She can't able to continue her studies, but she gained her knowledge by reading lot of books. Especially she was much interested in reading sociology and related with the health related topics and nutritious topics. She was very interested after getting completely cured, started reading homeopathic books, how emotions plays the major role in homeopathy. This is the beauty of homeopathy. Even every man other than homeopathy also starts reading once they enjoys the boon of homeopathy and beauty of homeopathy. Aversion to meat, this is very common symptom from her young age. Even sometimes when she was cooking for her family, even simply preparing the broth, she feels not comfortable with the broth. She feels nauseated while even cooking the food. Sweating will be very scanty, might be connected with the weather, because Germany weather won't be that much hot like India. But comparatively, she doesn't have that much sweat. Even the excess work also makes her to have only scanty sweat, that too in the summer times, particularly on her face and back, which will be very stinking. Even it creates the brown and salty deposition around the inner linen, inner garments. Urine is very normal at all seasons or all weathers, irrespective of any acute or chronic diseases. Her stool is very painful diarrhea, particularly whenever she tries to eat sweets and whenever there is a change of weather, because in Germany, weather change will be very common. They will experience all the 5 seasons in the particular country. Everything will be extremes of weathers. That also added her illness with the gastric issues. Again, this diarrhea is connected with the abnormal eating and abnormal craving of the sweets, as well as too much of fat items, too much of sugary items make her to get disagree, which is connected medically also. Menarche is very regular. She attained puberty around the age of 12. Periods are very regular, bright red flow, non-staining. It is not that much suffering for her. Every cycle is very regular and lasting for 4 days without any particular suffering in the menstrual cycle. She had the past history of breast excision, left side breast got surgery because of the left cancer. CEA breast, it happened in the young age of, I think, around first year of her marriage. I might be around 22 or 23 years of age. She got excised because first time itself she was ruled out with the third stage of breast cancer. That's why doctor advised her to remove the breast to avoid a recurrence of the cancer. Having 2 sons at that particular time when she started my treatment, after that in the middle of the treatment she got again cancer. So now she is having 3 sons, all are sons. Everyone is through cesarean section. Her father had a history of alcoholism with the bullying and emotional harassment. Through him, she experienced a lot as a childhood traumas. Her mother was a hypothyroidism. Here I mentioned the main thing regarding hypothyroidism. The reason is that again it comes under autoimmune disorder. This is the major reason for her inherited autoimmune disorder in her body, where she experienced the earlier stage itself with breast cancer. That also comes under syphilitic myasm, and as well as myositis ossifigans, where she suffered with the stages of necrosis and gangrene connected with autoimmune as well as. So her lifestyle completely, each and every disease is connected with the autoimmune disorder with the predominant miasm of syphilis because of the emotional traumas as well as the mental instability. So here, considering the mind part plays a major role in homeopathy. The reason is that to rule out to exclude and include, that is very important part before arriving the totality of symptoms. Because excluding part comes under the common symptoms of the disease, common symptoms of the miasm, common symptoms of the particular person, especially for example, if a lady who she is living in a Germany, she is comfortable with the moderate weather means it comes under the ambithermal, or you can take it as a hard personality. If the same lady telling that I am not comfortable in the winter time, even if it is around 20 or 15 degree, when she was suffering with the syphilitic phase means you should not take being a homeopath while evaluating the totality of the symptom. The inbuilt personality of the thermal heart plays a major role rather than chilly thermal. This is very common thermal to the syphilitic background. So each and everything is very important ruling out. That's why miasmatic background is very important for every disease. So considering this, the same thing connected with the emotional aspect also. Whenever the particular patient is suffering, irrespective of any disease, if they are having the stage of predominance with the syphilitic miasm, definitely the particular person will be too much depressed, too much anxious, too much fear. This is also comes under the common symptom of the stage of miasm where we have to exclude while framing the totality. Even the insomnia, considering the syphilitic background, comes under the common symptom of the miasm. So here, then what makes the peculiarity of the particular individual? The insomnia connected with dreams, insomnia connected with the thought process, because each and every person is connected with the emotions, each and every person facing all type of emotional traumas in their life. So here, considering the each and everything, how they are expressing out is very important to rule out the constitutional approach before arriving the simlimum. So considering this, her mental thought process relate with only whatever could be related with emotional harassment, emotional bullying, or lack of love, lack of care, lack of moral support, lack of financial support. Whatever could be, her overwhelming sensation is that taking care of the responsibilities in two aspects, because she got committed in her young age. That is the main reason for her. And also before marriage also her parents doesn't support her dreams, doesn't support her education, doesn't support her financially. That is also the added reason for her to get emotional traumas, to feel always, though being a mother, being a wife, being the head of the family, being the role of the head of the family, we have to think being a woman, the main priority is that the hectic course, whatever could be, the daily regular course, whatever could be, the additional work, we never should feel that we are overwhelmed. We are only having in this world too much of responsibilities. Whatever related with the routine works or whatever related with the both professional as well as the personal works, we have to do it with a desire which helps us to stay emotionally stable, which helps us to avoid preventing the diseases, especially the horrible diseases like autoimmune disorders. Here she finds solace in the form of creating art, using the art out of materials Might be if she was financially stable, she might be enjoying making the artwork. So here the main theme is that creativity is the main core rather than thinking about her peculiarity is making art out of waste. Since she was emotionally financially unstable, she wants to create artwork because that is her passion, that is her desire. She worked for many hours without feeling the overwhelming. So her overwhelming sensation is not her inborn nature or inbuilt constitutional nature. Her overwhelming is only related with the too much of commitments and too much of responsibilities. She take it out this creativity as she enjoys a lot as a business which helped her to support her family with bread and butter. She was completely disturbed and depressed because of the lack of support and day by day emotional trauma faced through harassment of the mental words and physical abuse through her mother-in-law. This is the main thing. Here I want to mention the main here wherever, especially with the long bones, myositis ossificans is very common, especially with the thigh bone. Here she faced with the tibia in the lower leg, in the shin part. The reason is that always the leg emotions, the leg part get disturbed irrespective of any reason related with arthritis, rheumatoid or osteoarthritis or myositis ossificans or related with diabetic ulcer or diabetic neuropathy or peripheral arteriopathy related with diabetes or deep vein thrombosis or varicose veins, always connected with the overwhelming sensation of the too much of responsibilities taking in the younger stages of life, especially supporting the family, to support the family, thinking that they are unwanted burden to themselves. This is the core theme connected with all the leg problems, especially with the woman as well as man, irrespective of any people. The leg part gets affected with the core theme of overwhelming sensation of emotional instability due to excess hectic schedules, excess responsibility, feeling of overburden to take care of the to support the family in any aspect. It can be related with moral or it can be related with financial. So she had the early childhood depression of father's domination and again the mental and physical harassment by her own father due to the habit of alcoholism. Her mother-in-law domination also ended with the lack of support from her husband. He never supported morally as well as financially. This added her emotional stress in her illness, contributed to the syphilitic stage of the autoimmune disorder. So, considering these symptoms as well as their case history, framing the totality through the homeopathic perspective, heart thirst moderate with craving for juice and milk, desire salty foods and sweets, aversion to meat, sleep disturbed due to anxiety of the disease and fright as well as future, childhood trauma of the father alcoholism, financial crisis, mother-in-law domination, lack of support from her husband, both financially and morally, ailments from overwhelming of the responsibilities in taking care financially as well as morally. So, want of appetite due to over emotional stress and overthinking, sweaty, scanty, stinking, staining the liver, especially in the back of her chest, aggravated by bathing. This is the modality related with her dressing, undressing the wound as well as the dressing the wound, stool, painful, stinking diarrhea, painful abdomen, especially whenever there is a change of weather as well as excess eat of sweets, sugary, disagrees to her body. Can anyone try what could be the remedy? Considering these personality justification and symptoms, any doctors want to try what could be the remedy? Okay, doctor, I'll continue considering the time. Here I want to individualize the particular theme. The reason is that I have chosen Calcarea Self till the end of the day of the cure. I gave only Calcarea Self 5 ch as repeated water dose. Here I want to mention what aspect Calcarea Self helped her as an exact simillimum, because what is understanding the core theme of calcium, how it works in our body, how physiologically calcium helps our body. By understanding calcium role as well as the sulfur role, helps us to rule out the simillimum, as well as I have made PPT along with the representation of the homeopathic aspect and homeopathic part of the Calcarea Self also. Calcium plays a major role in our body since it is an earth alkaline mineral. It connected with the mentally connected with the slow lethargy, indolent and anxious personality, aggravation from the cold weather, predominantly tubercular miasm, involvement of the nervous system, endocrine system, blood vessels, muscles, neuromuscular junction and neural disorders, with considering the edemators of any particular part. Calcium, Calcarea Self, plays a major role in the temperament of leukophlegmatic, related with the miasmatic background of Sora and syphilitic, especially the Calcarea Self, predominant, but psychotic and tubercular also combined here. The sphere of action here will be, so considering the calcium channels in the sphere of action, especially the Calcarea Self, takes part in the formation of spongy and hot, especially related with the alkaline or neutral tissues. Considering the organs, especially the bony parts, Calcarea group plays the major role in muscles, tendons, connective tissue, synovial membrane, nerve cells, axons, pleura, peritoneum, as well as the endocrine glands. The direction of the action, calcium plays a major role in the centripetal action. The cause lies within the body, but the disease appears outside the body. This is the core theme of the calcium as a homeopathic perspective, centered to periphery. The reaction will be alkaline or neutral in nature, maintains the alkalinity in the body, excreting the acidic secretion. So the degeneration and the accumulation part happens within inside the body. In the affected part, the discharge will be acrid and acidic when it is coming out through skin layer. The action on psychoneuroendocrine immunological level, they always have the sphere of action in the mental level, sensitive to the criticism, what others will say about him, insecurity and fears, protection and withdrawal. This is the core theme of mental theme of calcium, connected with homeopathic perspective, as well as the property of the natural mineral. Mentally, they will be always sad, depressed and melancholic with great anxiety. Here, the calcium features the depression. Calcareas always will be intelligent, irrespective of any combinations. Calcarea silicata, Calcarea ors, Calcarea sulf, Calcarea carp, Calcarea pars, Calcarea mure, whatever could be, they have the lack of implementation. They always needs the triggering force. they always need the support. That's why they always have the sensation of lack of insecurity as well as lack of moral support always plays the major role, especially in the autoimmune disorders, contribute to their illness. They always have the sensation of slow and sluggishness, whatever could be even connected with the daily activities, physical level as well as mental level. They always perform in the poor aspect. They can't achieve anything until unless then there is a triggering force or motivation force. The reason behind the need of support and the feeling of insecurity comes under all the calciums are taken from the earth, where it is extracted from the earth's crust, where they miss the mother's bonding emotions. They develop the insecurity sensation, which is seen in the human emotions. There always will be the dullness of the mind, imbecile and indolent. Calcareas are both mentally and physically obstinate because they can't differentiate what is good, what is bad. Because though they are intellect, they are not ready to analyze. Their analyzing skill is poor because of the overthinking process and because of always brooding about the insecurity as well as the lack of support. Persons always there will be the need of desire for company. They won't do too much on their own. They always need support. They always needs motivational force. Don't want any adventure in life. That's why all the Calcareas, irrespective of any stage of miasm or personality, they love to fix to the comfortable zone. They never want to achieve anything in their life, both professionally as well as personally. They always lives in a comfortable zone. They are very contented with what they are having in their life. They choose for themselves friends and partners who are very protective and whom they can depend. The reason is that they never believe, they have suspiciousness among the strangers. They are shy and reserved because the reason is that they need a time to understand, they need a time to build the faith upon the particular person. So that's why they are always have the nature of clinging towards the closed personality, closed peoples. That's why they always have too much of expectations. So, considering these theme, this is I connected all the calcium theme, calcarea related with homeopathic perspective. This is connected with the uh, uh, physiological function of the calcium in our body. Here, adult human body weighs 1.5 to 2 percentage of the calcium, where the grams of calcium will be 850 to 1400 grams. So, almost in the bones, 99 percentage the need of composition of the bones is made of calcium, though phosphorus, magnesium, potassium also needed for the bones formation. The amount of calcium in the blood will be 10 mg in 100 ml of the blood. So the dynamic equilibrium in the body is maintained only through the calcium from the blood to the skeleton. So the equilibrium is maintained in the parathyroid gland and cholecalciferol. That's why whenever there is an autoimmune connection with the thyroid or parathyroid problem, all the women, irrespective of any age, they faces the deficiency of calcium and vitamin D. Calcium has the role in neuromuscular transmission as well as maintains the ionic balance in the nerves. Whenever there is excess circulation of calcium ions or whenever there is a deficiency of the calcium ions, it leads to the excitability of the nerves, where later stages develops to the neural pathology of Alzheimer's, Parkinson's, or sometimes it connected with the epilepsy or aura. It also plays a role in permeability of the gap junctions. It plays the role of secondary and tertiary messenger in hormone actions also. Calcium plays a major role, particularly in the bed coagulation. If the calcium is very less, the prothrombin and the coagulation factor won't be proper, so that the patient faces the excess amount of bleeding, especially during traumas. Calcium needed by the body as an important mineral. There is a plenty of source. The need for the maintenance and formation of bone and teeth, coagulation of the blood, regulation of the neuromuscular irritability and muscular contractility. Simply, calcium is needed to maintain the mental calmness. So this is the stage of disease. This is before treatment. This is first week. This is third week. This is second week. This is sixth week, fourth week, eighth week. On the final stage for 1 week, I didn't even given medicine in any form. Either it related with the placebo or calcarea self. Here, calcarea self, I asked her to prepare calcarea self 1 poppy grain 5 ch to mix it in 100 ml of water. Till 100 ml of water get completed, she should not prepare new dose. She used that particular 100 ml preparation in a stored in a neat container. I asked her to take only 1 teaspoon considering the Avogadro's dilution as well as considering the infinite dilution. More the dilution, more the healing power. I asked her to take every 3 hours once for 1 week. The next week, considering her progress of healing, second week I asked her to take every 6 hours. I double up the interval. The third week I asked her to take 4 times a day. Fourth week I asked her to take 3 times a day. Fifth week I asked her to take 2 times a day. Sixth week I asked her to repeat. Seventh week I asked her to repeat only once a day. Considering only the one pill from calcarea sulf 5 ch, always completing the 100 ml of water. She has to take 1 teaspoon. Again, she has to dilute in 100 ml of water. She has to take every 3 teaspoons from the same preparation. She should not prepare the new dosage. This is the way of repetition through more minimum dose and single remedy with considering the more dilution to see the beauty of homeopathy with Herring's law of cure. She started getting more courage in her life. She started building her career in a different way. She created a shop also. She developed as an simple entrepreneur with her own business. So this is the beauty of homeopathy, where it made the survival of the fittest through the health recovery as well as making her to recover back mentally also, so that holistic approach in homeopathy plays a huge role in homeopathy. So calcium always helps to release the instability in the outer world, need for the security at home. This is a core theme here. Sulfur perspective, it is also again a vital mineral in our human health for the bodily functions, especially building up our DNA, protecting the cells, maintaining the oxidative process in the every cell of our body, preventing from the damage, helping in the metabolizing the food, as well as key component of proteins including amino acids, methionine and cysteine, which is vital for powerful antioxidants. So sulfur as a homeopathic perspective, they always have the intellectually, though they are intellectually inclined, they are very restless and dissatisfied nature, always seeking new experience. This new experience seeking, here the lady had it in the form of creativity rather than expecting the moral support, as the calcarea played a major role here. and having the craving for sweets and dislikes and disagrees of the bathing, aggravation towards the bathing, especially the core theme of Calcarea self. They exhibit a strong sense of individuality and independence. This also, here the lady, Calcarea self component I chosen, reason is that though she expects lot of support through husband or close to people, they she handled the life financially as well as moral support on her own, where the sulfur pot helped her to exhibit her independence nature. The tendency to be intellectually sharp helped her to build her business as well as to exhibit new ideas in her art out of waste. They will always experience the restlessness, irritability, and disinclination towards the handling work as well as responsibilities. So this is the beauty of the insight of Calcarea self. Uh, we have to understand each and every drug through this perspective, which helps us to learn to understand homeopathy in a beautiful way. It helps us to build the being a homeopath, understanding each and every insight of the drug helps us to build ourselves emotionally as well as morally to handle successfully whatever could be the cases. We can do wonders with learning the deep insight of every drug. Thank you for the opportunity for IFPH. Let us learn together and grow together. Thank you again. Thank you, sir.
Thank you, Dr. It's really a very good case, not only the case itself, but the presentation itself. All the beautiful way you have shown what are the things to be taken when one take the case, and what are the things you need to look into that, and at last you go to Calcarea self. Then why Calcarea self is the remedy, and why the calcium is important in healing process, and all those things were discussed, and really a great session indeed.
Thank you, sir.
This shows the power of homeopathy in conditions where surgery is advisable for from the other side, but homeopathy can do surgery without any tools other than homeopathy medicine. We can do it. That several times we have seen such wonderful cures with homeopathy in surgical cases. Anyway, it is the time for discussion, and those who want to uh, participate in discussion may please raise your hand so that we can allow you to unmute yourself, and you can directly go to uh, the question session. And there is one question in the chat box by Dr. Leta. What is the role of sulfur? Because you have mentioned much about the calcium, and why, what is the role of this calcium?
Sulfur.
No, it's calcium, sulfur.
Sulfur also I explained in the last slide, sir. The reason is that the creativity and the independency with taking the regular core in the form of, especially with that particular lady, though she needs have the insecurity feeling because of the emotional traumas, though she expects the lack of support from her own husband, though she needs moral support and emotional support as well as financial support, she can able to exhibit to choose her own business through her creativity, where sulfur plays a major role. The
Oh, that,
independency as well as the creativity, where she made her survival of the fittest through financially as well as morally. The
excellent
independence.
explanation. Excellent explanation, Dr. Bhuvaneshwari.
Thank you, sir.
Actually, what is the latest position of homeopathy practice in Tamil Nadu? Whether the number of dispensaries in government sector is increasing,
Yes,
or
sir.
it is, yeah.
Actually, among the common people, what I feel is that we no need of any advertisement, sir. They are approaching on their own. Even we can able to see in Kolkata homeopathic hospital, no doctor, how much
Yes,
patients are coming on their own.
exactly,
Homeopathy
exactly.
started exploring in such a way. We no need of any medical camps, or we no need of any awareness to teach among the common public. They are knowing beautifully how homeopathy helps to take care of their health and recover back.
Okay. I am inviting Dr. Manoj to say vote of thanks to the session.
Thank you, Dr. Sanesh. A nice session, Dr. Bhuvaneshwari.
Thank
And
you,
it
sir.
once again reiterates the significance of the individualization, the highlight of homeopathy. No other system can claim such a methodology that is most modern on the recent of the personalized medicine. It's an example for the visions of Dr. Samuel Hahnemann. So on behalf of IFPH, I expressing sincere thanks to Dr. Bhuvaneshwari and all those participants in this session. Thank you.
Thank you,
Thank you, sir.
Dr.
Thank you so
Manoj.
much.
Thank you, Dr. Bhuvaneshwari, and those who attend this evening. And tomorrow we will have a session from Dr. Baristo from Germany, and she will be talking about some of her veterinary cases with homeopathy. It's over to Dr. P. Shaila to moderate the Malayalam session. Thank you all.
Thank you, sir. Thank you.